Okay, I don't know how this is gonna record, but we'll see. So I decided to do this video because there's not very many good ones or that like really talk about it on getting a septoplasty and the turbinate reduction. So basically I've had a lot of trouble with my sinuses and getting a lot of sinus infections. So I've been hitting the nose a couple times, just accidents, nobody hit me in the nose or anything on purpose. But like one of the times it was like, I think a couple of the times it was a phone. Yeah. And so I had a bone spur on my nose. So it was like a bump. I could actually feel it. And that was kind of pushing on some things. And then, you know, of course that was pushing on things. And then the other side, like the turbinates were like enlarged to compensate for that space that was there. So this side was like super blocked. So it was always like, it had a constant sinus blockage in that side. And so that was just like constantly there all the time, and it sucked. So I was always taking, what is it, the Allegra D that's behind the counter. You know, that stuff's like $20 for like 12. So I was always taking that. You know, it helped a little bit, not very much. And then I would know when I was getting a sinus infection to take prednisone or go to the doctor. Of course, you know, that sucked. Because like I would feel it like my teeth would hurt because my sinuses would be so blocked here. So I decided to finally go to the doctor because I heard about the balloon sinoplasty that they could do in office. So I went to talk to the doctor and he was like, okay, let's try these medicines, see if this works. Maybe we don't need to do anything. So tried that, didn't work. And then he did like the kind of x-rays. He was like, yeah, we're going to need to do more than that because that's not really going to help you. But he said, once we do this, you shouldn't have problems anymore. And I was like, oh, thank God. So I had that done on the 5th, and it's now the 27th. Yeah. It wasn't bad. They put you down or whatever. It did hurt afterward. There's a lot of swelling, so I kind of had like ice packs. It was like gel masks on my face for a few days. They gave you hydrocodone. Didn't really do a whole lot. There wasn't really any bruising, maybe just a little right here. And as for the appearance, like since I did have a pretty big spur here, that looks a lot better than it did. So it does look better. Not sure if the snoring's better. It's supposed to help with that too, and I feel like I'm actually sleeping better because I can breathe. Because this side, like, I didn't know you're supposed to breathe that well out of that side, but yeah, there's still some swelling, just a little bit like here. One thing that they really don't tell you about is that right here, you're going to have some sensitivity and pain. So, you're going to want to have like soft stuff to eat for like at least a week or more. So maybe like pasta. One thing I like to have was like raviolis because, you know, they're easy to eat. Because your sinus, like your septum is like right here. And so they make like cuts like right in there. So this is going to be sore for a while. Mine's still like a little sensitive. And, you know, it's been over 2 weeks. You'll have dissolvable stitches, you know, splints in your nose. They're going to like, I'm trying to talk fast because this said it had like a 5-minute timer or some shit. But yeah, they put these splints in your nose for like 5 days. It sucked, but, you know, they pull them out. You feel a lot better. You kind of just flush your nose out with like the nasal rinse and pretty much like live with like this like saline like mist for who knows, another month or two. So I have a follow-up in another couple weeks, so see how that goes. I'll do another video.